Good morning and happy to be with you today for this very special webinar hosted in New York under the patronage of the United Nations for the UN 2023 Water Conference, which happened to be an almost half of the century event by fact. This is with a very good pleasure that I welcome you all for our new resources webinar hosted by Mokhtar Gawad, who is journalist, but who is also the head of communication of our think tank Resource. With us, Tatiana Thieme, Renaud Piarroux, Ouria Tazisadek, and Casimiro Vizzini. Each and all of you are going to be presented in a few minutes by Mokhtar, but as our panelist. But first, I would like, before handing over to Mokhtar, give a few presentation of our think tank Resource, which was born, in fact, in 2004 in Libreville, Gabon, during a founding symposium on the right to water and energy. Our think tank is a place, in fact, of free debate and proposal. But first of all, this is really a great human adventure which gathered together very different profiles, very different expertise, NGO representative, bankers, university professors, policymakers, institutions, but also leaders of the private sector, health experts, investment funds, and foundations. We all share the same, I would say, convictions that the access to basic essential services is a source of human development, but also dignity. Our mission is to alert, dialogue, and recommend and expose on awareness raising, with the ultimate goal to mobilize the attention of the decision makers and the media on the question related to access to basic services in emerging countries. We have no political affiliation or economic ideological dependence. We are working on conditions and solutions to ensure that everyone has access to these services, and in particular, in countries where sections of the population are marginalized. Today, our side event, Thieme, which is access to water in health systems, schools, and food market of the Global South, challenge and solutions, has been selected among the thousands of proposals to UN organizations and is subject to be positioned at the top of the agenda, particularly in emerging countries. So maybe a few figures to try to, in brackets, set the scene. I choose only three indicators, as I'm sure you've been exposed to several pack of figures since the beginning of this UN Water Conference here this week in New York. First figure is $200 billion as a need to close the water gap worldwide, out of which 60 billion for Africa only. The second figure is 1% today of the total investment for this is dedicated to Africa, which is a very poor number. And last but not least, only 1% of the Climate Finance Fund mobilized as of today is going to be in the water sector. Impacts on health, education, and food are on the top of the agenda for the 10 years to come, no doubt. It's time now to hand over to you, dear Mokhtar, for the good start of our resource webinar. Thank you all.
Thank you, Patrice, and I welcome to all of you. Indeed, it's the third and last day of the United Nations 2023 Water Conference here in New York. And I have to tell you that everybody here, every participant is asking, why have we waited so long to have this meeting? Despite the lack of access, as you mentioned, Patrice, to clean water and sanitation for hundreds of millions of people, despite declarations from the UN Secretary General who said, and I quote, "Clean water isn't a privilege. It's a human right and a common development denominator to shape a better future," unquote. Indeed, there are so many consequences from lack of access to these basic needs. inequitable, poor, degraded, or inexistent access to basic water services poses a fundamental threat to other vital needs such as education, health, and food. And the goal of our event today is to discuss these many issues by understanding their origins, their existence, and by proposing solutions, as you mentioned, Patrice. On a practical note, we will be together for an hour and a half, approximately. We will have 3 rounds of discussion with our panelists, then an interactive Q&A session with all the participants. The participant can add questions to the chat, and we will be asking some with to the guests. So speaking of the guests, what a panel. I'm very, very proud to have such a high caliber and of participants in our panel today, representing some of the best experts on the topics we are discussing today. And on behalf of our president, Patrice Fonladoza, and my colleague, Yoleni André, who prepared this side event, I thank the panelists and the audience for your participation. I'm now happy to introduce our panelists, all of whom are doctors in their area of expertise. Mrs. Houria Tazisadek, a lawyer, water, environment, and sustainable development expert. Mrs. Tazisadek is joining us from Morocco and will be speaking in French. She's the president of the Moroccan Coalition for Water and the governor of the World Water Council. Madame Sadek, nous avons accepté avec le président que vous parliez en français, mais bien entendu sur un plan pratique, notamment plus tard, nous allons mettre les sous-titres en anglais pour que l'audience y ait accès plus facilement. The second guest is Mrs. Tatiana Thieme, a University College of London Associate Professor of Human Geography. She joined us from London in the UK. Dr. Renaud Piarroux, Department Head of the Pitié Salpêtrière Hospital in Paris. Dr. Casimiro Vizzini is also joining us from Paris. He oversees institutional relations for One Sustainable Health for All Foundation. He replaced at the last moment Benoit Miribel from the same foundation. Thank you for that, Casimiro. So we will start. This is the first round of question, and I will start with you, Dr. Vizzini. We would like you to give us an overview on the concept of global health, which is the core of the work of your foundation, and why it is so vital to global health for everybody to have access to clean water and sanitation.
Thank you. Thank you very much. Thank you for having me here. On behalf of our Secretary General, Benoit Mirabel. Of course, One Health is extremely important to underline what is behind this concept. I like to say that is an old practice for a recent concept because it focuses on the increasing health outcomes around the world globally, but it also promotes equity, fighting and addressing health inequality. In the foundation, One Sustainable Health for All, we integrate the One Health concept to the global health concept. And I'd like to say that the One Health concept is the scientific approach that stays behind the global health, because One Health is the integration and interaction and the intersection, I would like to say, of the human health with the animal health and environmental health. And of course, when we talk about environmental health, water is such an element of such an importance that is one of the center of our discussion. We actually, the work of the foundation is structured in 6 working groups with different thematics. The first one is actually about the interaction with climate change, and we are promoting and implementing actions on One Water. One Water, because as you know, I mean, behind the concept of water, there's the concept of nothing is lost and nothing is created, everything is transformed. So this is links our nature with us, and it's extremely important to think that the equity is behind this concept, because we have common resources and we have to share it in a much better way. So if you can see this approach as an approach that is not just scientific, but is also an approach related to other disciplines linked to the management of systems of health, to the science policy, because we cannot forget that behind water there's a huge issues of science diplomacy, but also social issues, and then last but not least, education that is one of our priorities, because if we want to have we can have actions that are resourceful actions in the immediate present, but first of all we have to change mentalities, and this is what we try to do in the foundation also, and especially related to water issues. Changing mentalities is something that takes 1 or 2 generations, and that can be possible just through education. We focus a lot on education programs on climate change, environmental issues, and water related issues. I have actually been recently, and I don't want to be too long, in Bangladesh on mission with the foundation, working on the chars. The chars are these floodlands, sedimental islands that are threatened by the increasing of waters raising of waters in the Brahmaputra and Ganges rivers, and the access to fresh water to this population is one of the key elements of their development and their access to health systems. So this is just to give an example. There is the NGO Friendship, that is one of our partner, that is doing an excellent work trying to bring fresh water to this population in order to improve their health access. So just to give an example.
Thank you, Casimiro. I would like to ask to Tatiana now this question. You are a professor of geography, but also an anthropologist, Tatiana. You study the environment of our societies, but also their behavior. In reading some of your article, I noted that you have harsh words in some of your conclusion regarding the lack of access to basic needs. Sometimes you use phrases such as broken words, urban distractions. So my question is it too late, Tatiana, for all what you're doing now? Tatiana?
Thank you, Mokhtar, for that question, and thank you, Patrice, for your introduction, and everyone here. I'm very happy to be with you all today, and thank you, Casimiro, for getting us started. So to your question, Mokhtar, I should actually, maybe to start, I'll just, for anybody who's not aware of this notion of the broken world, and to assuage everyone's worries, this is referring a notion that is called broken world thinking, which is, I first came across the work of Stephen Jackson, who's based at Cornell University and who works in science and technology, and also an anthropologist himself, looking at different forms of repair and repair economies. So kind of linking to Casimiro's notion of nothing is lost and everything is transformed. There is a very vibrant economy of repair, in particular in the global south, partly because of necessity, but also because of an inbuilt kind of curiosity and coping strategy to think in a more circular economy where everything can be reused and fixed and repaired, which is increasingly coming into the global north perhaps as well. We can think of the Ellen MacArthur Foundation, for instance, and much of the work that is looking at circular economies, including with water and sanitation. But the broken world idea is a premise that says, if we can recognize that many of our systems, ecological, infrastructural, political, are in some way broken, can we actually start thinking about alternative possibilities from that starting point? So to actually think about broken worlds as productive points of intervention rather than as points of paralysis or depression. Because as we all know, if our car breaks down or if anything breaks and we have to figuratively and literally open the hood, increasingly difficult with smart cars, but with the older ones, it was possible, you understand how things work. So it's when the trains break down, it's when the garbage collectors stop collecting garbage in Paris, it's when, it's when systems that we take for granted break down that we understand and appreciate how they work and how they could work better or what needs fixing and who gets involved. So that is just to explain the idea of the broken world. So I come from a place not of pessimism in that regard. But to your point, Mukhtar, what I would say is that to build on Casimiro's introduction about water and the fact that it's not just about, as he said, science, but it's about these other disciplinary kind of considerations. One of the things that I'm very interested in is perhaps the other, let's say, the sibling of water, which is sanitation, which has often been a topic that has been camouflaged behind the clean water agenda and the potable water agenda and access to water. It's been now 15 years since the UN itself declared the year of 2008 as the year of sanitation, where water is life, but sanitation is dignity. And so I think one thing to remind us all is that I would surmise that everyone on this call perhaps has a toilet not far from where they are sitting right now, right? And so in a sense, it bears reminding that the lack of sanitation, water and sanitation being intermingled completely, the lack of that infrastructure is often seen as indicative of global socioeconomic divisions and a crucial public health and ecological concern. And one of the things that's notable by the World Health Organization, for instance, is that roughly a quarter of people lack access to what they call improved sanitation. And within that, it bears mentioning that only 30% of the global population has a flushing toilet connected to a sewer, 30% of the world, right? So in a sense, sanitation becomes a really interesting and important and crucial urgent window to debate issues around what is healthy, dignified, appropriate, and affordable improved infrastructure with regards to water and sanitation. And the two really cannot be disentangled. And it also becomes an interesting landscape for competing ideas. Those who come from the social enterprise and techno-optimistic perspective will, as Bill Gates once put it about 10 years ago, call for reinventing the toilet and think of it as an interesting opportunity for eco-sanitation solutions. And I'll say a bit more in our later conversation, perhaps about an example of that. But then you also have those who want to persist by believing that we should really improve full-on infrastructures that are built through piped sewers and piped water systems and so on. But what do you do when certain cities have been urbanizing in very different ways and in ways that are more about le bricolage and about makeshift urbanism and about place-based solutions that are off-grid? So to conclude my 5 minutes, because I don't want to take more time, I would say that there are two interesting possibilities, perhaps. There's how do we think about urban metabolisms more widely? We think about thinking of the body as a metaphor and the city as a body. How do we think about the flows and what blocks the flow, right? And what enables it? And for cities that are being built from scratch, we think of cities built in the desert or places like Dubai or certain cities in China that, where the urbanization has happened at such a rapid scale but can actually think about leapfrog technologies, smart metering, and all kinds of ecological transitions built into the urban infrastructure. That's one thing. But what about all the cities in the global south and even in the global north that have layers of historical infrastructures to contend with, where to even imagine improving infrastructure sometimes means removing entire communities? So there my pitch would be, we also need to pay attention to working with what is there, both for off-grid solutions that might go beyond the piped infrastructures, but also thinking about last mile delivery, which involves communities, local entrepreneurs, local tech, repair technicians, and so on. So I'll stop there.
Fascinating. Thank you so much, Tatiana, for that first introduction. But I will get back to you on some of these issues. Docteur Tazi Sadek, j'ai cité le secrétaire général qui disait que l'accès à l'eau est un droit. Vous êtes juriste, je le rappelle. Pouvez-vous nous parler de ce droit? Que fait-on aujourd'hui pour le respecter? J'entends le droit à l'accès à l'eau, ou plutôt, que ne fait-on pas pour le respecter? Docteur Tazi Sadek. Auria?
Voilà. Bonjour tout le monde. Merci de m'avoir invité et de partager ce webinaire avec nous. Nous sommes suivis, vous êtes suivis au Maroc. J'ai partagé autant que j'ai pu l'information. Merci Patrice pour cette invitation. J'ai été ravie d'écouter les deux intervenants précédents et l'importance des deux concepts qu'ils ont expliqués. Écoutez, le droit à l'eau, c'est un processus. Vous savez que les droits de l'homme, d'une manière générale, quand ils sont énoncés, ne s'appliquent pas comme les autres droits le lendemain. Ce sont des droits, on dit, progressifs. Donc, déjà, cette idée de progression dans la mise en œuvre et l'effectivité du droit à l'eau est un élément important dans la théorie des droits de l'homme. J'ai participé depuis le départ à cette revendication citoyenne qui, au départ, remettait en cause les approches techniques et technicistes, remettait en cause l'approche de l'offre centralisée et qui voulait placer au centre du débat la personne humaine. Et donc, ce qui a impliqué un véritable changement de paradigme, c'est-à-dire passer de l'offre à la notion de demande, c'est-à-dire comprendre les besoins des populations. Et tout cela suppose d'abord des connaissances différentes, des données différentes, et suppose également une gouvernance revisitée qui implique ce qui constitue les principes même de la gouvernance, en tout cas la participation, la prise en compte des intérêts des plus démunis, le cadre légal, bien sûr, et la transparence, enfin tous les autres principes, l'éthique, l'équité et la justice sociale. Alors, concrètement, on a repéré cette reconnaissance déjà. On peut dire que lorsque la Déclaration universelle des droits de l'homme reconnaît le droit à la vie, c'est lié à la question de l'eau, puisque l'eau et la vie sont liées. Maintenant, il y a eu d'autres conventions internationales qui l'avaient déjà expressément reconnu. La CEDAW, c'est-à-dire la question contre les formes de discrimination à l'égard des femmes, la Convention relative aux enfants, etc. Et puis, il y a eu cette observation générale numéro 15 des Nations Unies qui a été reprise dans des chartes régionales des droits de l'homme. Et il y a eu une sorte de progression au niveau des régions du monde et des continents. Et petit à petit, je pense que c'est devenu l'un des acquis de ce siècle. Des constitutions ont reconnu ce droit, à savoir la Constitution marocaine dans son article 31. Et ce processus a abouti à cette résolution de 2010 des Nations Unies qui donc consacre officiellement le droit à l'eau, et qui énonce les principes, et en tout cas l'un des principes les plus forts est la non-discrimination entre les personnes. Cette résolution a été renforcée. Alors, je n'entre pas dans le débat de la valeur juridique de la résolution, c'est un débat en soi, il faut qu'on le garde en tête, mais elle a été quand même renforcée par des résolutions du Conseil des droits de l'homme de Genève, qui en même temps reconnaît le droit à l'assainissement à travers plusieurs résolutions. Et donc cette consécration officielle du Conseil donne une portée supplémentaire à la résolution de 2010 de l'Assemblée générale des Nations unies. Alors évidemment, moi ce que je voudrais aussi signaler, c'est qu'en 2019, la Commission des droits de l'homme et des citoyens de l'Union africaine a adopté ce qui a été nommé les lignes directrices du droit à l'eau. Et c'est un document essentiel parce que d'abord, il définit les principes de référence et il donne l'étendue de ce droit et les moyens de son effectivité. Et il va au-delà de la résolution des Nations unies parce que cette résolution s'est limitée à l'eau potable. Et en tout cas, dans nos pays, la ruralité est importante. La paysannerie et l'agriculture sont importants. Et donc, ce travail de l'Union africaine, qui n'est pas connu finalement, qui n'est pas très connu, et je suis heureuse de pouvoir en parler aujourd'hui et de le faire connaître, et j'espère que les personnes intéressées par cette question iront regarder de près, parce que c'est un beau document de plusieurs pages, qui est très, très clair et donc qui intègre cette question de ruralité. Alors, l'effectivité du droit à l'eau. Il y a une partie qui est faite et qu'on oublie, c'est la disponibilité. Avoir de l'eau disponible est un moyen de rendre ce droit effectif. Après, il y a son partage. Comment cette eau est partagée et comment ce partage se fait. Mais ce qui aujourd'hui manque, à mon avis, et là je passe à ce qu'on appelle les règles générales des droits de l'homme, en matière de droits de l'homme, on doit prévenir, protéger et améliorer les politiques publiques pour que un droit de l'homme, en général, devienne effectif. Eh bien, la disponibilité peut faire partie de la prévention. Tous les pays font le maximum pour offrir de l'eau, en tout cas font tout ce travail technique qui est fait. Mais tout ce qui est protection, et donc là on arrive aux voies de recours. Puisque c'est un droit, que devient le citoyen qui n'a pas accès? Quel recours a-t-il pour revendiquer ce droit? Eh bien c'est là où il y a un manque. Pourquoi? Parce que d'abord, la qualification de l'eau comme droit dans les procédures, dans les codes de procédure civile, je parle des pays que je connais, je ne parle pas du monde en entier. Je tiens à faire cette remarque. Et les codes de procédure pénale ne sont pas faits pour ces voies de recours. Ils posent énormément de questions et en tout cas nous invitent à reconsidérer la totalité de ces procédures si nous voulions véritablement protéger, que ce soit le droit à l'eau ou le droit à l'environnement en général. C'est-à-dire que vous avez par exemple une pollution ou un manque d'eau, le besoin est urgent, eh bien, aller en première instance, puis en cour d'appel, puis en cassation et revenir à la cour d'appel, entre-temps, il se sera passé beaucoup de choses, des maladies, des morts certaines, etc., etc. Ensuite, par exemple, s'il fallait mesurer ou évaluer le dommage. En général, c'est le demandeur qui paye. Est-ce que le citoyen qui n'a pas d'eau a les moyens de payer l'enquête, l'expertise, etc. Alors, c'est toute une série de questions qui pourraient être réglées, mais il faut s'y atteler. Et donc, l'effectivité de ce droit, tout le monde est de bonne foi, il y a eu des reconnaissances, on pense avoir tout fait, mais il manque encore, sur le plan légal, des mesures à prendre, mais en même temps, il y a aussi la question de l'éducation, c'est-à-dire un droit se constitue de droit, mais aussi d'obligation et de responsabilité. Comment faire en sorte que ceux à qui on reconnaît ce droit comprennent qu'ils ont des responsabilités également. Et
Merci.
là, je pense que la question est essentielle également.
Très bien. Merci beaucoup, Madame Tazi Sadek. Bien entendu, nous allons revenir sur ces questions avec vous un peu plus tard. Dr. Renaud Piarroux, I want to raise with you an important point of our topic. The consequences of lack of access to water for children, from health to education. And that's a question is to you as a doctor, Dr. Renaud.
Thank you. Thank you very much. First for your question, and then for Patrice to invite me to this event, very interesting event and multidisciplinary event. What are the consequences of the lack of access to water and sanitation? And I will answer especially for children, because we will go to the topic of schools after. You have to know that each year it is estimated that more than 800,000 people die from diarrhea as a result of unsafe drinking water, unsafe sanitation, and problems with hand hygiene. This includes nearly 300,000 children under the age of 5. But water and sanitation is not only a question of diarrheal diseases. Lack of water to wash hands favors the occurrence of trachoma. This is the first cause of infectious blindness and visual impairment, and it affects almost 2 million people worldwide. It also, the lack of water also favors soil-transmitted helminthiasis. Finally, and this is less known, hand washing is a particularly important means of preventing flu and upper and lower respiratory infections. The impact is less obvious for COVID because airborne transmission is particularly effective for this particular virus. In children, the accumulation of diarrheal episodes, respiratory infections, and digestive parasitic diseases can have nutritional consequences that are all the more severe in the child if the child is subject to an unstable nutritional intake or prone to protein deficiencies. Undernourished children are more susceptible to infectious disease, which in turn further degrade their nutritional status. Furthermore, collecting water in a river or in a lake result in contracting schistosomiasis, a set of parasitic diseases responsible of millions of vesical cancers, as well as fatal renal and hepatic failures. Besides these diseases and human life lost, the lack of water and sanitation has also a considerable impact for economy and for education. And finally, the absence of latrines at home or at school forces children to defecate in the open air, with all the problems exposed, both in terms of health, impossibility of washing hands, overexposure to vector-borne diseases, and in terms of safety, risk of assault or even sexual assault. It should be noted that for reason of discretion, older children and adolescents, like adults, often prefer to wait until nightfall, which increases the risk of aggression. So I think I will stop for the moment and wait for the question. If you...
Yeah, Renaud, I can continue with you just for maybe 1 or 2 minutes. You mentioned on education, everything seems to be linked. The lack of access to water goes way beyond just water. That's it?
Yeah, Water-related diseases in general concern the schools, but also workplaces and healthcare facilities. Nevertheless, schools are among the most strategic places for hygiene and sanitation. Maybe this can be considered as the first strategic setting. On the one hand, schools are a place where the population gathers, in particular with young population more likely to contract and to spread infectious diseases. We can see this clearly in the dynamic of influenza epidemics and the respiratory viral infections, including in rich countries. On the other hand, it is also an ideal place to teach the hygiene, such as washing hands, brushing teeth, etc. We can even hope that the good habits acquired at school can continue into adulthood. Some even believe, I'm not so sure of that children can be effective vectors of hygiene measures at home. Even if the role of water in this setting is crucial, there are still many schools where there is no safe water at all and no latrines. In such context, children cannot wash their hands, so they are prone to iterative diarrheal disease, ocular infections, and so on. Finally, schools are by definition places of learning. Schools can allow a child to escape poverty. I had a very good friend, he's dead unfortunately now. He was in Mali and he started his life by herding goats, and thanks to school, he was able to become a professor of parasitology and a world-renowned researcher. So it is all the more important to avoid absenteeism due to illnesses, but also quite simply due to the lack of hygiene of sanitation infrastructure. If there is no possibility to go to the toilets during the school day, if adolescent girls do not have any place and facility for their menstrual hygiene, this can lead to absences or even a permanent abandonment of school. It is therefore important to provide children as well as teachers with correct hygienic conditions during the time spent at school. This includes easy access to water, quality water, the presence of latrines that close properly. This is very important. They also these latrines need to be well maintained and regularly cleaned. This also includes the possibility to wash hands after using the toilets. All that require a regular supply of soap, toilet paper, and hygienic towels. It is paradoxically often overlooked. In fact, both water and sanitation are human rights, as previously said, and gains from improved sanitation include increased school attendance, greater privacy and safety, especially for women and children, and at last, a greater sense of dignity.
Thank you so much, Doctor. So I will go to Tatiana before going back to Dr. Vizzini. Tatiana, we see this and we hear that from all of you, the challenges are big. And you mentioned that maybe it isn't too late, as I asked you the first question. We should maybe change the model that we are using right now to tackle these issues. The Western standards in sanitation, for example, as you mentioned very, very clearly earlier, may not be the solution for the global South. It is time for a different approach, and if so, what? Tatiana.
Thank you, Mukhtar, and yeah, thank you very much to Houdia as well and Renaud for those comments. I'm hoping to maybe sort of link a couple of my comments to the points made. There was a comment in the chat by Caroline Figueres, I don't know if I'm pronouncing it right, who made a very important point just a few minutes ago about the fact that the flush toilet is ironically the symbol of development and progress, right? This links to my earlier point that about 30% of people have a flush toilet in their domain. But this is actually not an ecological solution. And it's from a water scarcity perspective, as Caroline very well points out, absolutely something to interrogate. And so here I think it's an interesting kind of, it sheds light, that fact alone sheds light on the way in which we could try to create some kind of autocritique in these conferences and in the sector, to think about the historical tendency in wider narratives of progress and in the development and humanitarian sector in which WASH is often situated. We might think a little bit critically about the techno-optimism that has pervaded our discourses with a, if not a Western bias, or assuming that Western models were the de facto pinnacles of progress, assuming that improved infrastructures always meant a technical fix or the expertise of institutional actors. But in the context of water and sanitation, both are very private matters that are rendered highly public. The use of water for hygiene, the sanitation spaces we are all familiar with, every human is, these are highly private matters that are culturally, have different aspects around culture and gender and embodied practices, but they are rendered public the second they become part of a common resource, or Renaud mentioned open defecation. So they are rendered public. So I think one of the things to think about is, for instance, the ways in which certain cities, and as Huria very importantly pointed out, certain rural spaces outside of cities have always created different kinds of makeshift or bottom-up solutions in the absence of so-called modern infrastructures. So I'll mention a quick example, if I may. In Nairobi, where I've been working for the last 2 decades, it has become, ironically, a kind of East African hub for sanitation experiments, partly because, Nairobi is a little bit like the East African hub of a lot of the, UN, United Nations offices and other international NGOs. But it's also become, with Savannah Valley and other kind of tech innovation happening, a city where you have such contrast between the speculative urbanism and development projects and tech innovations on the one hand, in a sense, the mecca of digital banking started in East Africa, etc. But at the same time, over 60% of people are living in the most densely populated neighborhoods with a serious lack of sanitation and water infrastructure, echoing everything that Renaud says, right? The kind of dramatic effects on child mortality, as well as period poverty for young girls and adolescents who sometimes drop out of school because they don't have access to menstrual products. And then you have NGOs who are thinking quite optimistically but naively about eco-menstruation and bringing cups to all the girls in the schools, without thinking that actually those menstrual cups are fantastic if you have access to a water point right away and a private space to wash the cup and then your hands. So I would say that Nairobi has, just to put it simply, they have projects that are looking at eco-sanitation solutions. I mentioned Synergy, if anybody's familiar. So people from MIT engineering backgrounds who've got funding through the Gates Foundation for the Reinvent the Toilet to think creatively about how do we create eco-sanitation solutions for shared toilets in these densely low-income neighborhoods. Then you have Pipu, a self-sanitizing bag that can be useful in emergency situations because it almost mimics the flying toilet bag that people use when they don't have access to a toilet. You have the Eco Toilet franchise in the public spaces of Nairobi, which was David Kuria, the Kenyan Entrepreneur of the Year in 2010, who made sure that public toilets would be destigmatized and beautified, painted beautifully, guaranteed water and soap and a bit of toilet paper for everybody who was willing to pay 10 shillings to go in, and monetize the space by having space for local kiosks to operate their small businesses outside of the toilet so that people wouldn't be ashamed of hanging out there, right? So kind of an entrepreneurial urban story. And then you have neighborhood-based services, private providers of cleaning, public and shared toilets. So my point is, I don't think there's a one solution. There is no singular solution. But if you mentioned, Mokhtar and Yoreni, that this conference, one of the key emerging themes was cooperation. And sometimes different organizations and projects want to push their ideas as the idea. And there have been tensions between these different sanitation projects in Nairobi. And I've witnessed some of the disagreements between actors who think that one is dehumanizing and the other is naive and the other one, but together they create an ecosystem of potential interesting experiments that can work in certain situations. The women and girls going outside to frequent a public toilet, the lack of lighting on that path creates, as Renaud says, opportunities for being at risk of assault. In those contexts, what is seen as shameful and using a bag in your home actually is safe. The school that is a safe space to learn can be unsafe for a young woman who's menstruating and doesn't have access to a space where she has some privacy. And, so I think it's just about seeing this constellation of offerings and when they might work for different situations.
Thank you, Tatiana, for these concrete examples coming from the ground, someone who knows how to deal with this. So, Dr. Vizzini, I want to have your take on what Tatiana was saying about the cooperation worldwide on to tackle these issues.
Yes, of course, the cooperation is the element that has to be enforced because, as I said before, it's a transdisciplinary approach that can go. And Tatiana mentioned things that are extremely interesting. I mean, promoting practices or trying to introduce practices in cultural realities where this is not accepted or not common or hardly understood has no sense. I mean, as she said, we have to have a cultural approach to, and so I go back to my idea of education. We have to train people, but train people means training people in the North as well as in the Global South. Doesn't mean it's a top-down action, but the approach has to be much more horizontal. Otherwise, this will be the old-fashioned way of cooperation in which we bring Western solution to realities that have nothing to do with that. It is just losing money and energies. So what we promote through the foundation, of course, our foundation is Western-based. It's based in Lyon, and we work all around the world, but what we try to do is cooperate with stakeholders locally rooted, like friendship for the Bangladesh. I took this example before, but also in Africa and Latin America. And we will promote this kind of approach in the next global forum that will be organized in July in Lyon, but simultaneously, a few days before, we will have sessions of experts, local experts from regional realities like Southeast Asia, Africa, and Latin America, in order to have not only the global brainstorming that is absolutely needed, but also the local part of implementation. How can we apply what we've been thinking about, the solutions that we want to apply? We cannot keep thinking globally and trying to apply globally. It doesn't work. It doesn't work. So the point is going into the field and working in the field. But this has been said for decades now. I mean, I'm not the first one, and we are not the first one saying that. But unfortunately, we go back and forward to the same mistake, as she mentioned about menstrual cups. I mean, this is can you think to bring an extremely Western point of view into a culture in which will never work? It's just wasting money and energies and also time of people. So I think that the point is really creating links with the field, being there physically, and what I said, education in both sides, North and South.
That's a good transition to go to Houria. Houria, c'est vrai que on dit parfois que le Sud attend trop du Nord. Et vous citiez tout à l'heure des résolutions de l'Union africaine pour l'Afrique, pour les pays africains. Est-ce que les solutions à tous ces manques ne sont pas à chercher localement? Je suis sûr que vous avez vous-même au Maroc initié des initiatives locales et vous pouvez parfaitement nous en parler parce que le Maroc est vraiment un exemple, on l'a vu en tout cas, pour remédier à certains manques.
Écoutez, voilà un champ de réflexion pour essayer de changer les mentalités aussi. Parce qu'on parle de changer les mentalités au niveau des pays, mais je pense que nous avons aujourd'hui besoin d'un changement de mentalité planétaire. Pourquoi? Parce que cette année, on a tous été choqués et surpris par les sécheresses ici et là, en Europe. En fait, on n'a pas encore prononcé le mot changement climatique. Et l'eau est la première victime des changements climatiques. Alors, je vais vous donner 2 ou 3 petits exemples qui, moi, me font réfléchir, m'ont toujours fait réfléchir, sachant que le changement climatique a des conséquences et que ces conséquences, l'une des premières victimes, c'est l'eau. Pourquoi il a fallu attendre la 21e COP pour intégrer la thématique de l'eau et de manière timide, et elle n'a été réellement débattue qu'à la 22e COP à Marrakech. Pourquoi à Rio, on a adopté une convention sur la diversité biologique et une sur le changement climatique, qui sont des conventions cadres avec un mécanisme qui permet leur évolution et la prise en compte des évolutions, sachant que toutes ces questions sont des questions qui ne sont pas statiques et qu'elles sont toutes en évolution. Pourquoi l'eau, qui est quand même dans les INDC présentés à la veille de la COP 21, la priorité, en tout cas pour plusieurs continents, mais en tout cas pour le continent africain, pourquoi ne bénéficie-t-elle pas de cette préoccupation? Pourquoi les Nations Unies ont attendu encore 50 ans pour nous revenir sur cette question de l'eau, alors que toutes les autres questions reliées à l'environnement sont débattues régulièrement? Ce sont des questions que je me pose. En réfléchissant, on a tous quelques questions, mais peut-être qu'il faudrait véritablement se poser ce genre de questions, essayer de comprendre comment les décisions se prennent au niveau international. Alors, ça, c'est un élément qui me paraît quand même important. Aujourd'hui, on parle beaucoup de migration. Là aussi, pourquoi la migration qui est reliée au changement climatique n'est pas débattue, n'a pas été débattue dans le cadre, sachant que cette migration ne disposait pas de mécanisme international pour organiser les relations dans ce cadre, puisque la Convention des réfugiés ne la prévoit pas et les COP ne la prévoyaient pas non plus. Donc, tous ces retards ont des conséquences. Et aujourd'hui, est-ce qu'on va se décider à travailler un petit peu dans plus d'urgence? Parce qu'il y a urgence. Nous sommes dans l'urgence aujourd'hui. Alors, est-ce que les leçons doivent toujours venir du Nord? Les leçons du Nord sont importantes. Il y a beaucoup d'éléments dont le Sud a besoin. Ça, c'est indéniable. Sauf qu'aujourd'hui, le Sud sait gérer la rareté. Je pense que le Sud a des expériences en matière de gestion de rareté et en tout cas dans l'approche culturelle de la question de l'eau dont on pourrait se ressourcer également. Je ne dis pas que ce sont des leçons à transférer, mais mettons-les dans le package, dans les débats, et essayons de voir comment ça fonctionne, parce que je vous dis, le Maroc est une région aride et semi-aride. Nous avons les 2 tiers de notre eau qui se trouvent dans 3 bassins hydrographiques. Tous les autres bassins hydrographiques ont des quantités d'eau très peu. Et toute notre eau vient du ciel. Nous ne partageons aucun fleuve international. Nous avons heureusement 3500 km de côte. Bien, toutes les villes ont de l'eau et en continu.
Merci beaucoup.
Juste une seconde.
Pardon.
En matière,
je vous en prie.
En matière rurale, en 1994, 14% de la population avait de l'eau. Aujourd'hui, ça avoisine les 94-95%. Mais que ce soit pour le Maroc ou pour tout le continent africain, qu'il y ait de l'eau ou non, à part les villes marocaines, le rural, il y a un problème d'assainissement. Et le problème de l'Afrique, c'est bien sûr souvent l'eau, mais c'est surtout l'assainissement également. Pour faire le lien avec le thème de notre réflexion d'aujourd'hui, parce que les maladies hydriques sont l'eau est le véhicule les maladies hydriques, et je pense que redéployer les politiques de manière à faire de la prévention au niveau de l'assainissement, etc., pour diminuer les cas de maladies, etc., fait aussi partie des questions qu'il faudrait mettre sur la table.
J'ai bien noté, Madame Tatiana, Madame Tazisadek, entre les lignes. Je pose la question directement. Est-ce que vous pensez que la conférence a eu lieu aujourd'hui parce qu'il y a eu la sécheresse en Europe, où ça a accéléré le calendrier?
Si je vous dis oui, vous allez me traiter de complotiste. J'espère que non, j'espère que c'était prévu depuis longtemps, parce que quand même les Nations Unies ont mis en place le UN Water. Mais ça tombe bien, je peux dire que ça tombe bien, et j'espère que ça ne sera pas la dernière, parce que nous devons revisiter plusieurs questions. Et puisque vous m'avez questionné sur le droit, moi je voudrais aussi qu'on parle de ces eaux transfrontières qui sont partagées. Et il y en a 273 dans le monde. Il y en a 67 en Afrique. 17 seulement en Afrique ont un mécanisme de partage. Parce que les maladies ne viennent pas que de la pollution, elles viennent aussi des conflits qui pourraient arriver. Il faut penser à ces aspects autres que le lien direct entre microbes, assainissement et maladies. Il y a aussi le manque d'eau, il y a plusieurs éléments. Quand on pense à la situation du lac Tchad qui s'est rétréci de 10 fois, autour, comment les populations ont survécu, c'est le mot, hein, c'était de la survie après ce changement de la nature qui est inacceptable à la vue. Mais quand on lit les conséquences sur les populations, ce sont des conséquences importantes. Donc, vous voyez, c'est-à-dire que élargir le champ également de l'impact sur les personnes, c'est aussi une question intéressante. Mais évidemment, ça suppose de nouvelles approches, ça suppose des gouvernances adaptées. Ça suppose d'aller vers le local et de comprendre, mais ça suppose quelque chose qui est en déficit aussi dans ce continent d'une manière générale, c'est les données. Nous manquons de données exactes. Et les données, ce sont des données qui ne sont pas statiques, elles évoluent. Donc nous manquons d'observatoires pour avoir les données et de les avoir de manière actualisée au fur et à mesure. Et quand je dis données, ce n'est pas les quantités d'eau, ce sont aussi des données sociales, c'est-à-dire les données géographiques conjuguées aux données sociales.
Très, très bien. Merci beaucoup. We will switch now to one of also another panelist. Tatiana, how can we find the balance between solid technological innovation, which can take time and require a degree of requirement and regulation, and good enough innovation, which is more based on a resourceful approach? It's I think a very relevant question. Are there standards that need to be respected, and if so, which ones? As we try to find solution very I mean, urgently to this emergency. Tatiana.
Thank you, Mukhtar. Well, it's a very good question. So the balance between tech innovation and good enough innovation, and whether there are standards that need to be respected. I want to say, use 3 tiny empirical quick vignettes to answer that question, and also to, again, be in dialogue with my colleagues. So in the rural area in the Eastern Province in Kenya, I was I accompanied Plan International a few years ago for what was supposed to be a celebration of what was known as open defecation free celebration, which was the result of work that had been done through participatory approaches developed in East Asia, originally in Southeast Asia, by someone called Kamal Kar and other colleagues who were engineers, but also grassroots activists and practitioners, and who wanted to work with local communities to do what Casimiro and Huria are evoking, which is culturally appropriate solutions that are involving education, but not imposing external infrastructures, hardware solutions, or insensitive approaches. And so there's an approach for anybody who's interested called community-led total sanitation, CLTS. And there's lots of interesting case studies about it online that you can look up. One of the things that really marked me on that visit was the need to pay attention to cultural norms, even when approaches that get local buy-in and that are co-created by communities, they shed light on how we need to really customize solutions in each context. So the example is in this community in Eastern Province, in the Luo community, it is improper in a rural setting, and I deliberately talk about the rural because Huria mentioned the importance of la ruralité, which I think is really important because we have an urban bias. The world is now over 50% urban, but we still need to consider the rural as hugely important. And in the rural areas, in the Luo culture, you cannot share a toilet with your father-in-law. So if you are on a homestead on a farm, it was okay to find a discrete space behind a bush for your morning business. But the second that the community decided together to build latrines with appropriate local materials in collaboration with some of the local sanitation workers and health workers who were trying to incentivize them to think of the health benefits of building local latrines and avoiding open defecation, the family said, well, we need to build 2 latrines on our homestead. And so when Plan International and other local health workers and practitioners came, they were quite surprised. Why are there suddenly two toilets on these relatively small homesteads? And they explained the cultural norms of not being able to use the same sanitation space if you have if your father-in-law is living and with a daughter-in-law. So there's that kind of element of understanding cultural norms and adapting and customizing things that might have actually a combination of good enough, culturally appropriate, and some kind of thoughtfulness about the value of, in this case, what was technologically advanced was recognizing that ash, as opposed to soap that needs water, ash is a fantastic disinfectant. So if you have ash from, the fires from the day before next to the latrine, that's a wonderful way, without using water, especially during dry season, to sanitize your hands. And a dry toilet is much more sustainable than the aspirational idea of a flush toilet. So that's actually more technologically advanced or ecological than a tech approach that would call for a lot of investment and big tech. The second example is in Pune, in India, where there was a project I was part of a few years ago where some engineers and a coalition of engineers and sanitation practitioners were interested in understanding the perceptions of households in low-income dense neighborhoods about whether they would want to have an in-home toilet, a self-contained toilet. And through household interviews, we learned that especially women would show us, this is where I cook, this is where I have my water point, this is where I sleep. Where do you imagine a toilet in that configuration? How would that be safe during the monsoon? How would that not be a public health crisis? And so they said, I need 10 minutes to go to the next public toilet. For that, what I want is, can we improve the lighting so that we feel safe walking, as we always have to walk with 2 or 3 women together to feel safe at night? And can we make sure to have access to water in our public toilets? Because more than toilet paper in Indian culture, we need water in order to feel like we are, this is the appropriate form of sanitation and hygiene practice, is water afterwards. And my last example, to flip the global South gaze, is to think about Paris. We did a project last spring with Veolia and Eau Solidaire, Water Solidarity, a project that is trying to not only evoke what Huria says, which is to respect the human right of water, especially for lower income households. And so they don't charge low income households for water, but they want to avoid the water wastage. So they wanted to do household interviews to understand, why is it that there is so much water wastage in some of these copropriétaires and these kind of HLMs, the social housing, public housing, and these older buildings built in the 60s and 70s in the post-war period that are in degradation. Why is there so much water wastage? How could we educate the households? We found that people, many of whom were 2nd or 3rd generation migrants from across the world, and who often in their own cultures had very eco water usage practices. As Huria said, they were much more used to water scarcity in their home countries. And so they used basins to wash their clothing or their the dishes, right? Never really letting the water drip, etc. But the problem was the leaks in the building, right? And so here you see, yes, you need the role of repair technicians, plumbers, and so on. But in the absence of really always being able to call a plumber with the cost that it implies, there was a local group, social enterprise, that had a plumber on hand that would train residents to actually repair some of the small repairs that could easily avoid liters and liters of water wastage. And through the training at the base of the building, the training of those community residents, suddenly they started to talk to each other. And they also realized that one of the big problems for them was they cared less about water and more about the problem of garbage that was not very nicely handled at the base of the building. But through learning how to do this self-help repair, and they were also able to talk about, let's have some norms for our building around garbage disposal, recycling, and so on. So my conclusion is that there is kind of the importance of understanding perceptions, lived experiences, and coping strategies that are already there and working with those, but also to have a more lateral vision where we take into account things that go beyond water and sanitation, and that have to do with, cultural family norms and social ties, what seems appropriate, and also the idea of kind of, the importance, if it is a private matter rendered public, how do you get people working together, right? Who live together? How do you, agreeing on what's involved in maintenance costs or management or the commons. Managing the commons has always been a lifelong challenge for any of us living in communal settings.
Thank you, Tatiana. Fascinating. So, Dr. Vizzini, I want you to have a word about this solid technological innovation versus good enough. Even in medical world, it has to be always solid and good enough.
So, I mean, this is the eternal contraposition between the long-term and the short-term approach that, for me, is not useful at all. I mean, I strongly believe that both can be implemented together. Of course, the technology, implementation of technology is the short-term and the approach that we need. And when we talk about that in terms of water, we mentioned many different actions that can be done that are already implemented in countries. But we don't have to forget at the same time, if you want a problem to be solved, the short term is like the solution for the moment, but then you want to solve the problem forever. I mean, it's the same with crime. You can put someone in jail, but if you don't educate the population not to commit the crime, it will be repeated always. So it's the concept of balancing between short-term and long-term approach. And long-term approach is also done of many different things, policies. first of all. So decision makers has to be involved. Involved, it means being aware, knowledgeable about the issues, and take action on that. Invest in research and innovation, because we can have a technology today, but we can have better tomorrow, and probably the solution of tomorrow will be the one who will solve the problem, or we don't know. But if we don't if we don't start today, we will never know it. So I think there's no incompatibility between the two way of being active, let's say, in the field. And I totally think that we have to keep doing what is doing with that in the interdisciplinary approach that we've been underlying all around this conversation. But at the same time, we have to think about the future. Thinking about the future, it means, as I said, the long-term solution, action plans, policy, in partnership that has been also mentioned, and investing in research, investing in basic sciences, because this is the long-term solution.
Thank you so much, Casimiro. Before going to the participants' question, Renaud, I want to have your take on the cooperation, North-South, especially in your field. As Dr. Houria said, cooperation also has to come from South-North. And during COVID, you had such nice example of cooperation. Can you elaborate on that?
I can, but first of all, maybe I don't think my work in these terms of cooperation, North-South, South-North, South-South. I'm just doing my job as epidemiologist and specialized in fighting epidemics. And that means I have some knowledge, and I can share my knowledge where I can, where people want to be involved. And I have a story. Yes, for instance, I spend a lot of time fighting cholera, especially in Haiti, and to enhance the fight, we start to work with mobile teams. That means people that are working with the patients and going to the home of the patients, local people from the Ministry of Health and other people, and they try to find with the family the way to avoid secondary contaminations. I mean, they have to protect the water, they have to clean the toilets, they have to educate the people, but they work around the case and in the very local area to avoid new cases. And it worked. It helped to stop the epidemic a few years ago, even if it came back by other problems. But it was a very interesting way to tackle the epidemic as well. It is done for Ebola, for instance. And in Paris, we had that epidemic of COVID, as everywhere in the world. And at the time where I work in an hospital, and I found some people who came to the hospital because they were sick, and they didn't require hospitalization. It was difficult to have room for everybody, and so they were told to come back home. But at that time, they had no mask, no alcohol to wash their hands, and no help to fight the contamination, to avoid the spread of the disease in their own families. And I thought that it was a very similar situation than fighting cholera in Haiti. And I asked a colleague who was in Haiti with me, working with me, And we went to the director of the Assistance Publique Hôpitaux de Paris and said, we can do something to help people come back home and avoid the spreading of the disease in their family. And we started a project that was called Covisan. And this project was finally helped more than 100,000 people to come back home and to avoid contamination, and also to find new cases in their among their parents, so in their very close neighborhood. So that means some methods that are used in one place, sometimes in the north, sometimes in the south, can be used elsewhere. And we have to learn for every situation. And maybe the important word is to be on the ground, to be there and to see what is used, how to adapt the fight, and every time to try to find the best way according to the local context. Is it okay for you?
Absolutely. Thank you so much, Renaud, for that. So now we are heading to the questions from our audience. And et la première question est adressée à Madame Houria Tazi Sadek. Et on nous demande à propos de gouvernance. Quelle gouvernance faut-il pour garantir la sécurité hydrique?
Wow. Alors, d'abord, il faut qu'on s'entende bien sur le sens de la gouvernance, parce que souvent, on suppose que le réaménagement de l'administration peut être intitulé ou peut correspondre à ce qu'on appelle gouvernance. Gouvernance, si je devais prendre une définition consensuelle qui est celle du PNUD, il l'a définit par un certain nombre de principes, et que, en tout cas, la gouvernance n'est pas une fin en soi, mais que la gouvernance doit permettre d'atteindre un objectif. Donc, elle a un caractère fonctionnel. Et la gouvernance ne peut pas être pareille partout. Et donc, elle dépend du contexte et en tout cas du champ qu'elle aura à organiser. Mais en tout cas, ce que nous avons comme retour d'expérience en matière d'eau et d'assainissement, c'est que ce soit au niveau des pays ou au niveau international, il y a plusieurs entités qui sont impliquées dans le domaine de l'eau, ce qui est normal. On ne peut pas demander au ministère, par exemple, de l'Agriculture, de ne pas avoir une stratégie ou des actions. Le ministère, évidemment, de l'eau. Dans notre pays, le ministère de l'Intérieur, qui est le ministère de tutelle des collectivités locales et de la direction de l'assainissement, etc. La santé, l'éducation, etc. Donc, si vous voulez, il y a cette implication de multiples acteurs. Mais le problème qu'il y a d'une manière générale, c'est où sont les mécanismes de coordination et de synergie pour éviter d'abord les redondances, pour éviter qu'il y ait des stratégies qui ne correspondent pas les unes avec les autres, et que ce partage de tâches, parfois, est source de tensions. Parce qu'il y a aussi derrière tout ça le partage des budgets. Et il ne faut pas oublier l'argent. On n'a pas suffisamment parlé d'argent et d'investissement. Et donc, alors ça c'est une première remarque. La deuxième, c'est qu'on a compris que la gestion de l'eau ne pouvait pas se faire à partir du centre. C'est-à-dire, c'est une question qui est... La phrase « penser global et agir localement », ce n'est pas une phrase en l'air. Donc, il faut que la gestion locale également soit bien pensée et qu'il y ait suffisamment et de manière précise des articulations au niveau local, mais aussi entre le local et le niveau central. Ça, c'est au niveau des pays, en tout cas dans notre région. Sur le plan international, c'est la même chose. Nous n'avons pas comme c'est le cas pour la Convention cadre sur les changements climatiques, par exemple, un mécanisme qui coordonne et qui travaille sur l'évolution de l'organisation de cette question des changements climatiques. Et donc, il est temps, je crois qu'il est temps, vu ce qui nous attend, parce que si vous avez jeté un coup d'œil sur le dernier rapport du GIEC, c'est alarmant. Nous sommes dans une situation alarmante. Et donc, nous avons besoin d'agir de manière coordonnée et d'agir vite. Et donc, à quand, au niveau international, la prise en compte de cette question et à quand lui offrir le cadre qu'elle mérite pour agir dans les objets, et puis aussi pour aider à ce que l'objectif 6 puisse être atteint. Nous sommes en 2023 et l'objectif a pour date limite 2030. Est-ce que nous allons y arriver? Et je peux vous dire que depuis le temps que je travaille sur l'eau, et je pense que tous ceux qui m'écoutent seront d'accord, nous avons beau régler tous les autres problèmes, tant que la question de la gouvernance n'est pas une gouvernance adaptée et efficace, eh bien, il y aura toujours des retards et peut-être des choses à revoir.
Merci beaucoup. I have, 3 questions on one, but I think we already answered to 2 points of this question. Maybe Casimiro. Wilfried is asking what about an economical model. State invest in infrastructure, maybe in your area, and provide these services, or private sector invest, public, private, to tackle these issues? You believe in that, maybe, Casimiro?
So first of all, I think that in order to think about an economical model, and that was mentioned just before from Madame Tazis Sadek, we need to mainstream the concept. There's no, we have this absolutely useful and interesting conferences and we mentioned the governance that is centralized, and it's fantastic. And this is a way also to rethink about the economic model, to find the local solution, even for the economic model. I don't think there is one economic model that can be applied for everywhere. But if we don't mainstream water issues all around different actions in the ministries as well in the international organization, we won't find a solution. We won't find the good economic model. And this has been done for gender. Let's take the gender issue. Gender issues has become a mainstream all around governance, that from education to technology, from access to health to I don't know, all the different issues. We have to do the same with water issues. Mainstreaming will bring it to a much clever, smart way of approaching this issue, even economically. And once again, private-public collaboration, why not? It depends where. Investing in the long term, I said before, investing is the first thing that we have to do all around the world in terms of long-term solution. But investing the results of investment today is something that we will see in one generation. Let's be clear. So first of all, we need to start to mainstreaming water issues and avoid to create silos. Water is not a silos. The fluidity of water has to be also in its concept extremely relevant. So this is my point of view. I cannot answer to the single economic model. Once again, locally.
Thank you so much, Casimiro. We have 5 minutes left. So just before giving the opportunity to each of you to conclude, I want maybe Tatiana to answer to this question. Someone is asking this one: can we call for regular summit like COP on water that could allow monitoring and follow up on water sanitation? Tatiana, maybe a COP every year on these issues?
I think that these kind of conferences are very helpful because they can amplify local struggles and local concerns. So in that sense, they are important, and they are a public relations exercise as much as a gathering of coalitions. But I think one of the things that I'm left with at the end of this session is also reminding ourselves that whilst we talk about the potential for behavior change and education and global north, global south, or south-south, or north-south, etc., a transfer of knowledge, I think I would also emphasize the importance of not forgetting what Robert Bullard called environmental justice issues. So Robert Bullard, who's an African-American activist and scholar who wrote an amazingly important book in 1990 called Dumping in Dixie, and tried to, and coined the phrase environmental justice to look at the convergence between social justice movements and environmental forms of activism to combat local struggles. In the case of his book, looking at the United States in the South and the propensity of communities of color to be close to spaces that were toxic, right? So in terms of dumping, industrial dumping zones, and who is globally, which are the communities that tend to be most at risk and on the front lines of any kind of ecological harm. It's often those where the state and others have underinvested in their infrastructures, and where there has been some kind of either historical legacies or persistent continuities of injustice. So I would say that yes, these conferences are very important, but we need to also keep linking and paying attention to and being inspired by the local struggles and activists that have always been the trigger points of the more meaningful conversations linking social justice issues to these environmental concerns.
So in 3 words, please, each of you, what are the solutions to this issue? Maybe as we are with Tatiana, just in 3 words, conclusion.
My 3 words would be thank you to all. I learned a lot from Houria, Casimiro, Renaud, and I'm always delighted to be with Ressources and of Ressources. So thank you, Mokhtar, for fantastic moderation as well.
Houria, en 3 mots, les solutions, très vite, qu'est-ce que vous retenez?
Vous avez fait une très belle animation, merci.
Non, mais je parle du fond, du fond.
Écoutez,
les solutions pour vous.
Je pense que les solutions devraient faire, pour arriver à avoir des solutions acceptées, pérennes, il faut prendre en considération les contextes locaux et faire intervenir les locaux dans la définition des problèmes et des contextes pour ensuite arriver aux solutions. Je pense que cette question est importante. Et puis, n'oublions pas que nous avons une eau qui est salvatrice, mais l'eau peut devenir destructrice. Et donc, une fois qu'on a dit ça, faisons de l'eau un secteur d'opportunité, parce qu'il ne faut pas toujours traiter la question de l'eau comme une question de défi et de désastre. C'est aussi une niche pour le développement et qui offre des opportunités, y compris des opportunités d'emploi pour les jeunes, et aussi des opportunités de partenariat et de rapprochement entre les pays.
Merci beaucoup. So Renaud, in 3 words, please.
I fully agree with Houria about the solution. When she spoke about the solution, there is a crucial need to involve and to discuss and to share the solutions with the local people involved in the local context. And this may help to find solutions elsewhere. And that's my words, just sharing expertise, sharing experience, and using this experience to find solutions in any settlement.
Thank you, Renaud. And finally, Casimiro.
Thank you. I will say, let's bring awareness about water. I think it's the first step. That we don't have to wait for the crisis to act. And so, as I said before, mainstreaming and awareness, and then thinking in at the same time in the short term and the long term solutions.
Thank you so much. Just before conclusion, I would remind our audience and our panelists to two upcoming events from our think tank Resource on March 28th. I mean, it's next Tuesday, actually. We are organizing a conference on the evolution of international water law in the light of its integration into economic law, the challenge related to water in Africa in the framework of the 4th Annual Day of International Law in Africa and Paris Arbitration Week. That will be next Tuesday. And the second event is the Europe-Africa Forum, second edition, on Tuesday, May 16, 2023, in Marseille, south of France. So finally, I want to thank the United Nations again for inviting our think tank Resource on behalf of our president here, Patrice Fonladoza. So thank you, the United Nations 2023 Water Conference. Thank you to our brilliant panelists. And to the audience, please follow us on our social media means and especially on our website, www.thinktankresource.com. This is the end. Thank you so much, Patrice.
Thank you. Thank you very much, all of you, and in particular our panelists, of course, who gave us some very different viewpoint, enlightenment on this so beloved subject of water that we are pursuing for years and years now. Thank you, Mokhtar, as being a timely moderator and very organized. And of course, the one that you don't see here, but who's been instrumental in the organization, who is a coordinator of the think tank Resource, Yolini André. I'd like to have a great thanks for her. United Nations, thanks again to give us the opportunity to express and be part probably of a very small progress, but a top. Thank you, all of you, and à bientôt, Uria. Thank you, Tatiana. Thank you, Casimiro. Thank you, Renaud. Bye.
Thank you. Bye.
Thank you.
Thank you all.